this pandemic is actually deepening inequalities and will end up with a world which is even more unequal than it has been before. There is a big digital divide in terms of the kind of infrastructure that is available in different parts of the world, the kind of personal equipment that people have, the kind of ability, facility that they have to make use of this. But more importantly, I think that reliance on digital also has much more deeply embedded systemic effects, that there's greater reliance, for example, on digital technologies and artificial intelligence. Well, you know, that you can have digital diagnostics, telemedicine, and all of that, and the sort of the digital divide in terms of access deepens those inequalities in access to health. But we also know that deeper down, in a more sophisticated, in a less transparent way, that there are biases that get built into the collection of data in big data that drives AI. We know that access to health is unequal, and everywhere in the world, once again, living in New York, it has become a big public issue, an issue of public debate, that population groups that are disadvantaged and who happen to be low income, migrants, immigrants, so forth, these vulnerable and already marginalized populations are disproportionately at risk of contracting the illness and vulnerable to suffering from it severely. Beyond the health sector, there are the economic consequences, the loss of income, jobs, other opportunities, social opportunities that are lost, such as education of children, are once again very disproportionately borne by the marginalized and vulnerable groups. And I will give you the example of the garment sector. What has this pandemic meant for people working in that value chain? You know, when this pandemic came out, you know, obviously people weren't buying clothes, so there was a reduced demand. And then, boom, you know, the order is canceled. Did they get paid? No, they didn't. That just shows you that the costs are borne disproportionately by people at the very bottom of the value chain, who can least afford to absorb the shock. The reason why the loss is borne by the people at the bottom is all due to the social institutions that we have of political bargaining, right? Power asymmetries. In fact, in many cases, the contracts had provisions for cancellation, but in fact, you can declare force majeure. In order to do that, you have to be a well-resourced organization, not only in terms of money, but also in terms of expertise. This also illustrates the importance of the structures of power that is actually a driver of how, you know, how the cards fall. It's not just accident. It is that in this market, the least well-resourced players actually are least able to negotiate for their rights. We need institutions that protect those rights, you know, that provide a safety net. We can learn some lessons from other crises. You know, for example, When there was the HIV AIDS crisis, there was a mobilization to protest the high prices of the retroviral, antiretrovirals. And so there was a political mobilization of civil society groups, governments of the global south, that were able to also build alliances with concerned citizens and develop a sense of solidarity. You know, as a result of a lot of this kind of awareness raising, as well as solidarity, as well as changes, there is a lot more accessibility for some of the essential medicines. However, even there, I would say that there has not been enough of a systemic change, because, you know, certain provisions are made for this particular disease or that particular medicine, but it's not enough of a systemic change, so that today, once again, we are discussing who will be setting the prices of the vaccines when they get developed. Who will pay for the development of the vaccines? You know, it's actually taxpayer money or philanthropic money, right? Because there are a lot of governments that are pledging to finance the development of new vaccines. And yet, you know, we have to ask, are there provisions in the agreements where the private sector uses this money to develop new vaccines, that they will be priced at an accessible level for low-income people and low-income countries that cannot afford huge bills? I still believe that human rights, particularly economic and social rights, the right to health, as well as the right to life, the right to a decent wage, right to fair working conditions, right to education. These economic and social rights are rights, and these are not to be traded away. There is no contradiction between, like, securing the right to life, right to health, as well as a healthy economy. On the other hand, we do know that the institutions of the free market are not adequate to make sure that there is that complementarity that gets built up. And so you do need institutions of safety nets. You do need to consider health as something that is not a private commodity, but a public good. And that is the reason why you cannot consider a vaccine to be a free market commodity like any other. And because if it is a free market commodity, it's not very profitable for pharmaceutical companies. And that is why, in fact, we have a crisis already of vaccines around the world. I hope that the pandemic will, once, you know, reveal the importance of solidarity. I hope that the fact that you cannot protect yourself in Europe if you are going to have countries in Africa unable to access vaccines, for example, will make it quite clear that we are not only interdependent in terms of public health within our communities or within our country, but also globally. And so, you know, this is a moment where international cooperation and a sense of international solidarity is particularly important.